An aspirin a day, it might help keep you living longer. A study from the UK finds that a daily aspirin reduced deaths from cancer by about 20%. But what does this mean? Is it too early to recommend that people start taking aspirin to prevent cancer? Let's bring in our expert now. Dr. Larry McCahill is Medical Director of Surgical Oncology at Lax Cancer Center. Doctor, thanks for your time tonight. This study indicates that an aspirin regimen lowered the risk of cancer-related death up to 20 years down the line. Is that possible?
It is. The trial was published in a very prestigious journal, The Lancet, which is our, the UK version, the New England Journal of Medicine. And the intent of these trials, clinical trials, and they were very well done. They were randomized clinical trials, but they were actually intended to look at cardiovascular deaths or prevention of stroke or heart attack. They looked at 7 trials, and they had follow-up on all 7 of the trials for about 7 to 10 years, and then 3 of the trials they were able to follow out for 20 years. And the surprise finding is that they looked at cancer-related deaths, and those were reduced by up to 20%. For gastrointestinal cancers, colorectal, as much as 50% reduction in cancer-related deaths.
And these are significant numbers, and you just mentioned that because aspirin's been around a lot. We know that it's been in use for cardiovascular disease.
Right.
Will this treat how cancers maybe are addressed medically? Does aspirin now become part of the regimen?
For an active cancer diagnosis is a little bit different than trying to preventive regimen, and I think the big thing that's going to, there'll probably be some U.S. task force that looks at whether or not this should be a standard regimen in the primary care setting, because in the real world this would be a blockbuster drug finding to have a 20% reduction in cancer deaths. That's a huge finding.
Yeah.
And this was a very well done study, and I think the findings are going to be held up.
Well done, respected, but it still might be a little in its early stages here because there are some drawbacks, as we know. So for some folks, they can't tolerate aspirin as well.
Correct. I think this should definitely be addressed with the patient individually with a primary care physician because the study does not address any deaths or complications related to the aspirin use. So there are side effects such as gastrointestinal bleeding, which in rare circumstances can be fatal. So it definitely needs to be patients need to be cautioned to discuss it with their primary care physician.
Absolutely. Check with your doctor. But again, some exciting findings here
it's
across
very
the
interesting.
pond in the UK.
Yep.
Dr. Larry McCahill, Medical Director of Surgical Oncology at Lax Cancer Center. Thanks for your time tonight, Doctor.
Thanks for having me on.